Normally, you're not aware of your heart beating. When we do notice it, this is a palpitation. They feel like a fluttering or a pounding or a thud or movement in your chest that might last for a few seconds or minutes. You can feel it in your neck, your throat, or through your ear when you're lying down. Although they can be unpleasant, palpitations are common and in most cases harmless. They can happen when you're active, but also when you're resting, like watching TV. A heartbeat is generated by an electrical signal through the heart. If there's an error or abnormality in the signal, it can cause the heart to beat too quickly, slowly, or irregularly. Your heartbeat is often described as a lub-dub sound, which is the sound of your heart filling with blood and then pumping it out to the rest of your body every minute and hour of every day. Sometimes this rhythm can change for a brief moment when you feel like your heart beats faster or skips a beat, or you're just more aware of your heartbeat. Usually these palpitations are a normal variant of the heartbeat, and this isn't worrying, such as an isolated extra heartbeat or a run of many extra heartbeats, or even a missed heartbeat. In some cases, there may be a medical reason behind them, and sometimes they need urgent attention. There are plenty of times when your heart fluttering is nothing to be concerned about. Your heart rhythm can change because of your emotional state or activity level. It can even change because of what you've recently put into your body. I tend to break down palpitations into two types, those caused by heart conditions and those caused by other causes. Other causes include things like lifestyle triggers such as strenuous exercise, not getting enough sleep, too much caffeine, alcohol, smoking, illegal drugs even. In these cases, the palpitations should go away on their own. Avoiding these triggers will help stop them from coming back too. Emotional triggers such as excitement or nervousness, stress or anxiety, and panic attacks. Breathing exercises and managing stress will help manage and prevent these types of palpitations. Palpitations can be triggered by certain medications, including asthma inhalers, blood pressure medications, antihistamines, antibiotics, antidepressants, and antifungal medications. Heart palpitations in women can sometimes be the result of hormonal changes that happen during things like periods, pregnancy, or menopause. In these cases, the palpitations are usually temporary and not a cause for concern. Then there are other non-heart medical conditions that can cause palpitations, including things like overactive thyroid, low blood sugar, anemia, hypotension, high temperature, and dehydration. Palpitations are sometimes caused by a problem with the heart rhythm, known as an arrhythmia. These include things like atrial fibrillation, which is the most common type, where the heart beats irregularly and faster than normal, or atrial flutter, which is a fast and irregular heartbeat too, or other types of irregular heartbeats like SVT or VT. Some palpitations may be associated with other types of heart conditions, such as heart valve problems or hypertrophic cardiomyopathy, where the heart muscle and the walls of the heart become very enlarged and thickened, and heart failure, where the heart's unable to pump blood around the body properly, and even congenital heart disease, which is where birth defects affect the normal working of the heart. By far the commonest heart cause of palpitations is ectopic beats, known as atrial or ventricular extrasystoles, which are essentially early or extra heartbeats leading to a short pause before or after the extra heartbeat, giving the sensation of a missed beat. They're common, harmless, and don't need any treatment unless they're really bothersome. You don't usually need to see a GP if the palpitations that you experience pass quickly and happen occasionally. They're unlikely to be caused by a serious problem and probably don't need any treatment. But it's a good idea to see a GP if your palpitations last long or don't improve or get worse, or they cause symptoms such as dizziness, shortness of breath, fainting, chest pain, or tightness, or you have a history of heart problems, or you're just concerned and you just don't know what's going on. The history is really important in understanding the likely cause of palpitations. What brought them on? Exercise onset is a red flag, and it could be a serious issue. And how long do they last, and how often are they? We often ask you to tap the rhythm out in clinic. And were there any other symptoms? What about your medical history? Things like high blood pressure, diabetes, Thyroid disease is associated with atrial fibrillation and flutter, while anemia is associated with a faster heart rate, and emotional stress and lack of sleep and fever are often more associated with those ventricular ectopic beats. What about family history of heart disease? Did anyone die below the age of 40 years in your family due to heart problems? And do you take any other medications, things like inhalers or antidepressants or antibiotics? And what about alcohol, caffeine, nicotine? Do you take any recreational drugs, especially cocaine or heroin or amphetamines? The examination is useful too, especially the vitals like fever, the pulse, the rate and rhythm. Is it normal right now? And what about the blood pressure? We would listen to your chest to check for extra heart sounds that indicate valve problems. Listen to your lungs too for any signs of heart failure, and look for signs of those other diseases that we mentioned earlier, like anemia or thyroid disease. If you're having palpitations during the consult, we'd arrange an ECG immediately. And if not, then soon. You may need to attend the hospital to do this, as not all GP practices perform 12-lead ECGs. The challenge with an electrical tracing of the heart is to catch the palpitation, this flutter or missed beat or sensation on the reading, so we can see exactly what it is. If your symptoms are short-lived but frequent, like daily, then a 24-hour or 48-hour tracing called a Holter monitor, which constantly records your heart rhythm, allows for a broader time frame over which a palpitation to occur and record it. A broader time frame over which a palpitation can occur and for it to be recorded. If symptoms are short-lived and infrequent, so for example less than once a week, a self-activated recorder or an event monitor is an appropriate option here, where you can just press a button when you get the symptoms and a device that you're wearing will record what's happening. In some circumstances, also arrange an ultrasound scan of the heart called an echocardiogram if you have any additional heart sounds or if structural heart disease is a consideration. If after the provisional tests and history the cause remains unclear, we may refer you to cardiologist for further testing, assuming you're not acutely unwell. Sometimes, if you're being seen in your GP clinic, if you have a very erratic heart rate or you're unwell, we may call for an ambulance to take you to hospital. If you're at home and have palpitations, you should seek emergency help directly by calling 999 or go to A&E if you have any of the following symptoms: severe shortness of breath, chest pain or tightness, dizziness or lightheadedness, fainting or blackouts. These symptoms could indicate a serious or potentially life-threatening heart problem that should be checked out straight away. For the vast majority of people, admission or even referral is not needed, especially if the palpitations are isolated, the ECG is normal, and there's no worrying features from the history or the examination that we mentioned above. In these circumstances, we'd often advise you to avoid triggers, cut out the problematic foods and substances, and to take care of your body. Remember, most palpitations go away on their own without any treatment. In fact, palpitations that are infrequent and last only a few seconds don't even need to be evaluated. They're that common. Depending on the cause though, we may need to do more specific investigation and treatment, such as drugs to control a heart rhythm or to change your medications. Other things to consider if you suffer from regular palpitations is driving safely due to the risk of fainting and blackout. Do see the link in the description below for more information about driving safely and how long it takes to get back to driving after suffering with palpitations. Thanks for watching. Till next time, stay healthy.